Hello, I'm Ashley Morgan, FNP student at Maryville University, and this is Zach, and he is my volunteer for the head to toe assessment video for Nursing 612. Before my assessment, I would ask him as the patient to take off his clothes and put on a gown, empty his bladder, and then I would be assessing his gait as he walked back to the room. Prior to that, we had checked his near-sighted vision and far-sighted vision with the Snellen chart. And as I'm walking into the room, asking him his name and date of birth, I am checking for facial symmetry of the eyes and the nose and the mouth, the ears. I'm going to start by inspecting and palpating the scalp, inspecting for any masses or lesions or bumps, abnormal bumps, any tenderness, inspecting the scalp, seeing that it moves freely, checking the thickness of his hair, checking the thickness of the hair on the eyebrows and the eyelashes. Those are okay. I'm going to move on to inspection of the conjunctiva and the sclera. The sclera is white. It should not be jaundiced or red, and it is not. The conjunctiva is pink and moist. There is no tearing and no discharge from the eyes. They are symmetrical. Next, I'm going to move on to inspection of cranial nerves, the face. So Zach, I'm going to have you close your eyes and squint. Then open, raise your eyebrows. Okay, good. Smile, clench your teeth, stick out your tongue, move it from right to left. I'm checking here for any deviation. Everything is symmetrical. Eyelids open and close symmetrically. There's nothing wrong there. Next, I'm going to move on to sense of touch, inspecting the facial nerve. I'm going to have you close your eyes and you tell me where you feel me touching. Close your eyes. Tell me where you feel me touching.
Left cheek. Top of the right cheekbone. About the upper right lip. Left of my mouth. Chin. Other side of the chin.
Okay, good. Everything checks out good there. Next, I'm going to move on to inspecting the nares. Checking here, if you'll look up for me. Checking here for patency and checking the septum for any deviation or crusting or bleeding. I don't see anything there. Everything is pink and moist. I'm going to inspect your patency of your nostrils. If you'll close one nostril with your hand and take a deep breath in, sniff. Okay, and on the other side. Okay, everything is patent there. I'm going to go on to the oral mucosa and the soft palate, the pharynx of the mouth and the uvula. The oral mucosa is pink and moist as it should be. If you will lift your tongue up, I'm inspecting underneath the tongue for any lesions or signs of oral cancer. Everything looks fine. While I'm doing this, I'm also inspecting the teeth, looking for characteristics, if there's any missing or broken teeth or dental caries. Everything here looks good. Next, I'm going to move on to the soft palate and the pharynx and the uvula. I'm going to have you open and say ah. Tonsils are 1+. There's no exudates on those. There's no redness or swelling of the throat. I'm going to check the gag reflex. And uvula, say ah. Okay. Checking to see that the uvula is not touching the soft palate and that it moves up and down symmetrically when he says ah, and that checks out fine. Next, I'm going to move on to the ears, inspecting the auricles, palpating for any lesions, masses, swelling, pain. Feel any pain with that? Nothing there. Then I would, with the otoscope, if I had one, mine's broken, checking the tympanic membrane as I pull the auricle up and out, checking the tympanic membrane for any perforation, any swelling, any discoloration. They should be pearly gray. You might have some cerumen, but not over a large amount. And shouldn't see any perforations or holes in the eardrum. Should not see any swelling or fluid or drainage there. Moving on then to the neck inspection, I'm going to check some range of motion here. Zach, if you will turn your head from left to right, and then up and down, and then side to side. Everything is normal there. I'm going to go on to inspection of the thyroid and the trachea. The trachea is midline. I'm going to have you swallow now. Feel the thyroid move up and down symmetrically. Don't feel any mass or enlargement there. I'm going to move on to inspection of the lymph nodes, the pre-auricle lymph nodes, the post-auricle, occipital, the superficial cervical, deep cervical, supraclavicular nodes, the inferior clavicular nodes, and the axillary nodes. I'm checking here for that all the nodes move freely, that there's no hard or enlargement or masses of the nodes, and no tenderness. Did you feel any tenderness with that? Okay. Then I'm going to move on to inspection of the anterior chest wall. I'm going to place my hand here on the precordial area, checking for any thrills or excessive vibration sensations. Don't feel anything there. I'm going to move on to the apex to check the apical pulse. And again, feeling for any vibrations or thrills. I'm going to check for tactile fremitus by having the patient say 99 each time I move my hands.
99, 99, 99.
Okay, nothing there. I'm going to go ahead and listen to lung and heart tones anteriorly and then posteriorly. After my percussion, okay, and here I'm listening for any hyperresonance or resonance. I don't hear any, but if I did, that would be indicative of fluid or air where it should not be. As I am doing this inspection, I'm checking for labored breathing, respirations, that they're normal, normal rate and rhythm, depth. Everything is fine here. I'm going to go ahead and listen with my stethoscope. Deep breath. Shouldn't hear any crackles or wheezing or rhonchi. Should just hear clear bilateral lung sounds. Next, I'm going to move on to heart tones, checking for normal S1 and 2 rate and rhythm. I don't want to hear any rubs, any friction, gallops, or murmurs. I'm going to check here and listen aortic, pulmonic, Erb's point, the tricuspid, the mitral, and I don't hear any abnormal heart tones there. If you will stand up and turn around, then I'm going to listen and percuss posteriorly. Again, I'm listening for any hyperresonance, any dullness. It could be indicative of air or fluid. Okay, and then while I'm back here, I'm gonna check the diaphragmatic expansion. I'm gonna have you take a deep breath in and hold it. Okay, when I hear the change in sound, I'm going to mark that point. I'm going to have you take another deep breath in, exhale, and then hold it. And when I hear that change in sound, I'm going to check that there's a 3 to 5 centimeter difference there, and that checks out fine. I'm going to go ahead and listen posteriorly to all the lung fields. Deep breath in and out. I'm doing in a bilateral systematic approach. Deep breath. In. Okay. While I'm back here, I'm going to go ahead and palpate for any masses, tenderness, or lesions. I'll inspect the skin. I don't see any abnormalities, no rashes, no breakdown, and no asymmetrical moles or okay. And then if you'll go ahead and turn back around and have a seat. Okay. Then we're going to go ahead and check here for actually go ahead and lie down. I'm going to be inspecting and palpating the abdomen. Checking the contours of the abdomen, checking for any hernia or checking for any pulsation that could be indicative of an aneurysm. There's nothing here. I'm going to go ahead and percuss the abdomen. Again, I'm listening for any tympany or dullness, which could indicate fluid or mass of visceral tissue. I'm going to go ahead and percuss for the liver, borders, and the spleen. The liver should be 6 to 12 centimeters. And then I'm going to go ahead and do a palpation, soft palpation, checking for any tenderness in all 4 quadrants. Do you feel any tenderness there?
No.
If not, I'm going to go on to deep palpation, then feeling for the liver, kidneys, and the spleen. I should not feel the liver or the spleen. Checking on the other side here for the right kidney. No abnormalities there. I'm going to go ahead and listen to bowel sounds for up to 2 minutes. And then after that, I'm going to be listening for frequency and characteristic. Okay. He has normal active bowel sounds. Okay, I'm going to go ahead and have you sit back up. I just realized that we forgot to do the Rhine hearing tests. I've got my tuning fork here. We're going to do the whisper test first, so if you'll cover this ear, I'm going to whisper a word and you tell me what it is. Apple. Cover the other ear.
Orange.
Okay. And I'm going to take my tuning fork here, and I'm going to hold it on top of his head, and he's going to tell me, we're going to make sure that he could hear the sound equally on both sides.
Yes.
Okay. And then we're going to do air and bone conduction test of hearing with tell me when you no longer hear the sound.
Yes, right now.
You don't hear it?
Mm-hmm.
Let me do it again. So he's going to tell me when he no longer hears the sound at the mastoid bone, and then I'll move it to the auditory canal, and then he'll tell me when he no longer can hear the sound then.
Can't hear it. Don't hear it. Now I hear it. Don't hear it.
Okay, that's good. The air conduction should be about twice as long as the bone. Okay, now we're going to test the upper and lower extremities. If you'll hold both of your arms out. I'm going to be checking the skin again for any rashes, lesions, checking temperature, should be equal on both sides. Checking the nail beds for any cyanosis or clubbing. Capillary refill should be less than 3 seconds, which it is. I'm going to check the radial pulses, making sure they're equal on both sides. Brachial, making sure they're equal on both sides. I'm going to test the brachial reflex. Okay, and then we're going to move to the lower extremities and do the same thing there. I'm going to check the temperature and touch. I'm checking both extremities for any peripheral edema, which there is none. Temperature, making sure the temperature is the same bilaterally. I'm going to be checking the popliteal pulses bilaterally, the posterior tibial pulses, and dorsalis pedis pulses, making sure those are bilateral. Checking resistance on both sides. If you will push up, step on the gas, push up, step on the gas. Okay, it's equal on both sides there. Now we're going to go ahead and do a pupil reaction test. If you will cover your left eye, okay, and look straight ahead for me. Okay, I'm checking here that there's no involuntary twitching or nystagmus movement of the right eye. If you'll cover the other eye here. Okay, and none seen there. Okay, now focus again with both eyes straight ahead, and just follow the end of my pin here. Checking the cardinal gaze positions, extraocular eye movements, making sure that the patient doesn't move his head, and he's able to focus on the end of the pin without any nystagmus or involuntary eye twitching. Okay, now if you'll, we're checking for pupillary reaction here. And they are round and equal and reactive to light and accommodation. Now if you'll cover your left eye, I'm checking the peripheral vision. Tell me when you can see my fingers on your right.
You see it?
Okay, cover the other eye, I'll do the same thing. And
see it?
Okay, very good. Okay, last but not least, I'm going to have you stand up. We're going to check the cervical, thoracic, and lumbar spine for any abnormalities of curvature. Should be a nice curve here. Shouldn't be any, I'm not trying to say, shouldn't be any abnormal curvature here. Everything is normal. If you could lean forward just slightly, checking here that the shoulder blades are even, bend over even more. Touch your toes. And looking here, inspecting for any curvature of the spine. Everything is fine. Okay, you're good. Stand up. Okay, you can sit back down. Okay. And that concludes my head to toe assessment. Thank you.